we're live and we are ready to start. So, thank you everyone for being here. Today is another webinar, 10 tips to never worry about falling and not getting back up. The reason why we put this together is because this is the number one concern for all of our patients that are over 65 is I don't want to fall. I'm afraid if I fell, I wouldn't be able to get back up. So from exercises to stretches to tips, things to do at home, what to eat, I have a lot of tips there for those of you who are joining us for the first time. And we've got some people joining us from the East Coast before, replying, messaging back on social media. So I realized I need to really introduce myself. A little bit about me is my name is Dr. Alex Tam, my wife and our daughter Addie there. We celebrated her birthday this year. She loves horses, as you can see. I received my Bachelor of Science in Exercise Biology at UC Davis. And I've been a clinical director here at Absolute Integrative Physical Medicine since 2009. We treated over 10,000 patients in our office, probably close to 12 to 13 now. And our mission in the office is to help patients with chronic pain get their life back without harmful drugs and unnecessary surgery. So fall-related injuries, we're going to dive right in. Then we'll do a couple of raffles throughout and at the end as well. So the number one thing is, why are we doing this? The reason why we're doing this is because over 1 million Americans visit the ER annually due to slip and falls injuries, averaging 2,000 cases every single day. Now, you might think, well, slip and falls, we've had it all before as kids, but as we get older, every slip and fall injury can be very costly. It can be ranging from 30 to 40,000, depending on what actually happened, from hip problems to ankle problems, to foot problems, you name it. Expenses from hospital stays, nursing, rehab, community services, medications, it costs a lot. So we want to prevent something that could be easily prevented if possible, right? Now, slip and falls are also a very significant injury as well. It not only affects us when we're young, older, right? Yes, there could be non-fatal emissions, during this group, but you just never know. I want to make sure that we have as little falls as possible, unless if it's self-induced, like skiing or snowboarding, you're bound to have some of those, right? But for all age groups, fall-related injuries is the number one reason for missing work. And it's the leading cause of workers' comp cases, especially in individuals 55 and up. That's why I always tell you, if you ever see our staff changing light bulbs, I said, get a spotter, right? Or 9-foot ceilings, someone's changing a light bulb, someone needs to spot them. We do not need any falls as we talk about falls, okay? So as we get older, not only having a fall can cause problems with your hips, the wrists, right? As you extend out and try to brace your fall, the humerus, the pelvis. Those of you who know people who've ever had a pelvic fracture, boy, that is a debilitating injury, okay? And for those of us who don't know if we are osteoporotic or not, it's really easy to fracture a hip when you have osteoporosis, okay? So on top of that, it can cause hematomas, joint dislocations, cuts, sprains, and worse yet, sometimes they are internal injuries that you might not even realize that can cause other issues as well. Now, tips, I'm going to give you all the tips on how to prevent falls. And then if you do fall, these tips will also help you get back up. One of the key things in protecting your hips and muscles and legs and preventing falls and getting your balance back is you have to build up your muscles. See, one of the big reasons why we fall and break a hip is because we don't have enough muscle surrounding the hip area, so that the moment you have a fall, it's just concrete bone, right? And then boom, a hip can fracture. So tip number one, I'm going to focus a little bit more on the exercises. Exercises is not usually the most favorite thing that patients want to hear, right? Oh, you got to do your stretches and exercises. Oh no, why do I have to do that? Do I have to? Yes. Yes, you do. Okay. So squat walking. How you do this is you mimic a squat, but you're walking at the same time. So you're taking squatting steps back and forth. The reason why this is so huge is because this not only builds up your glutes, your butt muscles, your quads, but it also increases your flexibility. Because in order to do a squat, you got to be somewhat flexible, okay? Because if not, then your quads and your hamstrings, they're going to tighten up. If you get really good, you can actually put a resistant band above the knee while you're squat walking. You can do the crab walk where you go side to side. You can do the squat walk front to back to front, right? This is a huge, huge, huge movement. For those of you who are afraid of not being able to get back up after a fall, yeah, we do fall, right? We can fall. That's not, falling is sometimes inevitable. Okay, maybe you're holding on to a bunch of things. Like my wife earlier this year, she fell holding a pot of soup. She fractured her fifth metatarsal. Okay, it wasn't it wasn't great, but you know what she said when she got back up? She says, "I saved the pot of soup." She didn't spill the soup. We came in, took an X-ray, and she had a fracture, but she was able to fall, hold onto the soup, and get back up. Right? We practice this, and so should you. Tip number two, you have to start working on strengthening your hand grip. How do you strengthen your hand grip? You either do a dead hang like this guy is doing, or you hang on to something and just bend your knees. Let the weight of your body, maybe not the whole weight of your body, but maybe part of the weight of your body, hang, bend your knees. So then you have to grip. If you don't grip, you're gonna fall, right? Or you have to let go. But before, of course, grip, and before you let go, or before you fall, let go and then stand back up, right? Now, the reason for this is because when we fall, what do? We grasp for things. Say if you're going down the stairs, right? When you fall, you grip onto something. You grip on the handle, you grab a wall, you might grab onto your partner. You're just reaching for something so that you won't fall. But if you had weak grip, you will slip, right? You will slip. We need to be grip, and being able to squat. Actually, how long you squat and how much you can grip and or dead hang is actually an indicator of longevity. All right. It's actually an indicator of longevity. Optimal is at age 40, we should be able to dead hang. Optimally, 2 minutes. If you're male, 1.5. If you're female, same thing. 2 minutes squat, freestanding squat. At 40, a minute and a half, a female, 2 minutes at male. And that number decreases, right, to say a minute by the time you're 60 to 65 to 30 seconds. Okay. So make sure you're able to increase your grip strength. You can use a pull-up bar, you can use resistant grippers, you can even be at the park and hold on to a bar and just start leaning. As you lean, you have to increase your grip strength in order so that you won't fall. Okay. So make sure your grip strength is so, so huge. Number three, make an appointment with your healthcare provider. Why is that? Because one of the things that increase falls is actually medications. Pain medications can cause dizziness. You know, all those medications that you're told can cause drowsiness. What do you think happens when you get drowsy? You lose balance. This is the funny story. Maybe you guys hear it too. For those of you who have kids or have grandchildren, my daughter, when she gets sleeping when she was like about one, so 1.5 maybe. So she's walking, right? And then she gets sleepy. She might tell you, hey, Addie, you want to sleep? No. She say no, but she walks like a drunk, right? Because she is so drowsy. She's like running into things. I'm like, nope, going to bed. She starts falling all over the place. To me, it was the funniest thing, but for her, she was just trying to resist sleep. But medications can also cause dizziness. A lot of them have drowsiness, and that also increases your chance of falling. How about your vision? Check your eyes. Is one nearsighted and one farsighted? Gives you a headache, maybe vertigo. Are your equilibrium, your ears are off. Maybe you have positional vertigo. Okay. Maybe you have an ear infection. People who have ear infections or chronic ear infections, terrible balance as well. So check with your doctor for that. Okay. Tip number 4, wear sensible shoes. What does that mean? When you're walking like days now, where it could be wet outside, wear shoes that have grip. Okay. Don't just wear these flip flops that slip on and you're walking around in these wet areas. Wear grippy shoes. You have to know, especially if you're in the snow or in ice, you have to wear special shoes that are made for that weather. Regular shoes cannot go on ice, right? So you got to make sure you're doing it correctly. Stick with shoes that are, fitting, form fitting. Don't wear shoes that are too loose when you're going out, right? High heels. I mean, they all increase the chance of slipping, stumbling, and falling. So make sure you wear the correct shoes. Okay. Number 5, clear your home with any potential hazards. If you have wires, if you have mats, if you have kids and you got Legos laying around all over the place. I hear from parents all the time. I step on a Lego and I fell, right? Or grandparents do the same thing. I tripped on a toy because your peripheral vision, you're not even thinking about all the toys that are 4 feet lower than where your eyes are, right? So you got to make sure if you have tiles that are uneven, you got to look into that. Surfaces, when I tell people, we had a patient who was doing remodeling and they're 70, about 75. And they were talking about remodeling the bathroom. And I made a comment. I said, make sure when you remodel your bathroom that your tub is grippy. It's not one of those marble rocks where it's like super easy to slip on. Your tiles, I said the same thing. Make sure your tiles have some grip on them, or like you place a mat. Don't just look at what looks good. Okay. So you got to pay attention to these things. And if they're loose, fix them. Get it fixed right away. Hire a contractor, a handyman. It's much cheaper to fix it now than try to, than have a fall later on. That can cost way more. Number 6, light up your home. Now, a lot of you, I've heard it before. Oh, I run into the wall. Like I'll ask patients, what happened to your shoulder? Oh, I ran into the wall at night. How you ran into the wall at night? That's common, but that also means it's time to get a night light, right? When you fracture the outside of your foot, it's actually called a bedroom fracture. The reason why they call it a bedroom fracture, look it up, medical term, AKA bedroom fracture. The reason why they call it a bedroom fracture is because so many people get up in the middle of the night, whether it's their the nightstand, their bed, their legs sticking out, their couch, whatever it is they can't see, they ran their foot, the outside of their foot, boom, it runs right into it and they fracture the outside of their foot. And it's called a bedroom fracture. So make sure nowadays they got those lights where it senses motion, right? That turns on, or when it's dark, it turns on and it beams directly onto the floor. So it's not lighting up your whole room. This is something that is very, very important, especially if you're going up and down the stairs. Okay. Make sure you guys are doing that. All right. So now that we've just gone through tip number 6 over here, half the tips are in. Now, what we are going to do right now is we're going to get a drawing here of some of the folks that are here. And my assistants told me about this wheel. Whoever gets the first one, you come to our office and get the first L-arginine. Nancy, you're it. So sometime this week, you come in and pick up your L-arginine. We're going to have a couple more winners as we go along.
Thank you.
Okay, absolutely, Nancy. Thank you. Now, the next tip, okay, is going to be make sure you use assistive devices. When you're going up and down the stairs, hang on to the rail, okay? If you have to use a cane or a walker, I tell patients the number one reason why people are not using canes and walkers is not because it doesn't fit, okay? It's because it doesn't look good. I don't feel comfortable, confident walking with one. And I tell them this. I said, you can use one at the beginning, but work towards not having to use one. We had a patient 2 months ago, came in a walker. First visit was in a wheelchair. Second visit was in a walker. By week 6, they were already walking without a cane. I said, see, I said, this is what happens when you work on this, right? But she was so embarrassed at the beginning. But I said, well, if you had a fracture, a fall, or something, wouldn't that even be more embarrassing? Right? That's even more embarrassing. So make sure you're using the canes and walkers when you're getting up and down from the toilet seat, right? You do enough of those squat walkings, you'll be able to get up and down pretty quickly. But beforehand, use the armrest, the grab bars, the shower bars, right? So make sure you use these things. It's so important to get them installed. Do not wait until you have a fall to get these installed in your home. Don't use pride and have a fall later. Okay, don't let the pride get in front of you. Number 8, how do you keep your bones healthy? I promise you, it's not milk. The highest drinking milk consumption countries in the world have the highest rates of osteoporosis. You're thinking, well, that can't be. Milk has a lot of calcium. Milk does have a lot of calcium, but it's not calcium that you can absorb. It also has a lot of hormones, which builds big, brittle bones, like a puffed Cheeto. Okay. You don't want puffed Cheetos as your bones. You want like chopsticks. All right. So, what are some of the most absorbable calcium that you can eat? It's going to be in your greens. It's going to be in your salmon, your spinach, your broccoli, your kale, right? They have the highest, richest source of absorbable calcium. Okay. Make sure you're eating vitamin D, right? You're either taking it or you're eating it in eggs, you're eating it in meat, right? Cod liver oil, salmon once again. Now, if you are taking calcium supplements, make sure you take ones that are high quality, but also make sure you're taking vitamin D3, write this down, D3 and K2 with it. If you are taking calcium without taking D3 and K2, instead of the calcium going into your bones, they're going to get lodged in your blood vessels. And now you get hardening arteries, and now you develop atherosclerosis. It is not uncommon for me to see patients who have been taking calcium for years, and the aorta, the huge blood vessels coming out of their heart, is completely calcified. And I can actually see it on x-rays. And a lot of times I'll ask them, you've been taking calcium, you've been drinking a lot of milk, right? It's being absorbed into their blood vessels and they're taking it all the wrong way. So make sure you do it right. Okay. Avoid loose clothing. Don't wear these MC Hammer pants, right? So certain styles come in and out. I'm not telling you, I'm not a fashionista. I'm not trying to tell you what to wear, but wear clothes that aren't just dragging all over the place, right? This is actually one of the things that increase the risk of falling. You're walking and then you have pants on one leg that are so much looser than the other side, and you end up turning and you stepping on one and your other leg can't move, boom, you fall, right? So make sure clothing wise, you're doing the right thing as well. And number 10, I got to give us a plug, right? Here's the thing. One of the big reasons for falling is because if your hips are out of alignment, which affects your knee, it can cause weakness in one knee or the other. If your hip's not aligned, your knee's not going to be aligned and your foot's not going to be in alignment as well. Make sure you get your body aligned the right way, okay? Because when your hips aren't aligned, you will notice, and I promise you, those of you who are aware are going to notice it. You're going to be able to take one step a lot bigger than the other step. You're going to want to go upstairs with one leg a lot more than you want to go with the other leg because one leg's going to be looser and the other one's going to be a lot tighter. Okay. If you have that, is it going to be a big problem on a regular basis? No, not on your day-to-day walks. But what if there was a kid running towards you and you had to quickly pivot, but yet one leg doesn't move as quickly or is a lot weaker? That's when it matters, right? When your safety, say if you're crossing a crosswalk and the car is coming and you can't move quick enough and you end up tripping over yourself, right? So these are very, very important things that you should look into as we get older, as we age. We want to age gracefully, right? Building the muscles of flexibility and everything else. Well, thank you for participating today. I really appreciate all of you. We have tip 1 through 10. We have a couple more prizes. Because you guys are here today, you'll receive a PDF copy of today's presentation. This webinar won't go online for another week or two. So I'm really glad that you guys are able to hear it right now. Now, I did also save some time for some Q&A after we have a couple more prizes. Let's go with the wheel once more. This is just so fun. I'm going to start doing this in the office. Oh, Crystal, all right. Come in and get yours. And
And
lastly,
oh wow.
yeah,
Are you guys open today?
we're here.
Uh,
And Agnes, all right. Awesome, awesome, awesome. Okay, perfect. Well,
Thank you.
Thank you so
absolutely.
much.
Anyone have any Q&As, questions? I've got about 6 minutes. If you got questions, ask now. You can unmute yourself.
I try every morning to do like twisting my feet, my ankles, and everything, and go back and forth and use my toes and my hand, my fingers, else. And I do like the yoga stance, the warrior pose and
Yes.
stuff,
Okay.
stretching and stuff like that. And I go the what's that? Chuck Norris, the machine. So
Yeah,
that
the total gym.
yeah, that helps out a lot. And believe me, that helps
Oh,
out.
that's wonderful.
Yeah.
Yeah. We got to exercise. We got to keep our muscles building. You know what? That's another reason why we got to build muscles
It keeps
is
you balanced.
it keeps you balanced. But here's another thing. Sugar as we age,
Uh-oh.
or hey, uh-oh,
Hmm.
the big D word, diabetes comes up, right?
Yeah.
As we age, why is it that we're more likely to have diabetes? You can be thin, but you still might get diabetes. Why is that? That's because as we age, we start to lose muscle. One of the best ways to get sugar out of your blood is your body stores it in the muscles.
Hmm.
So guess what? If we start losing muscle mass and we're eating the same thing as we were, where's the body going to store the sugar? In the liver now,
Uh-oh.
right? You don't have enough muscles to store it. You end up getting a fatty liver. And then if your liver can't hang on to it, then it ends up in the bloodstream. And all of a sudden, you start noticing tingling in the fingers. tingling in the feet, your bowels don't work right, your vision starts getting worse, you start losing your hair, the nails. That's because that's the onset of your body failing to remove sugar in the system. That's pre-diabetes settling
Mm-hmm.
in, right? This is another reason, on top of the falls, to make sure that you have good muscle mass.
So
Okay.
if you have pre-diabetes and you've been diagnosed with pre-diabetes or high cholesterol, is there
Mm-hmm.
any way you can reverse it by exercising and minimize your sugar intake?
Absolutely. There's tons of studies out there.
Mm-hmm.
As you build muscle, as you work with your food and diet, it's something that has been shown in many, many studies, and we've seen in our own office to be
Mm-hmm.
reversed over
Mm-hmm.
time. Yeah, it's not one of those things where once you have it for life. Most people think that,
Mm-hmm.
and most doctors will tell you, "Oh yeah, once you have it, you're done." No, that's not true.
Mm-hmm.
That's not true. One of the best, most well-known nephrologists in the world, his name is Dr. Jason Fung out of Toronto.
Mm-hmm.
He wrote the book called the Diabetes Code, I believe.
Mm-hmm.
And him and his clinic, they reverse diabetes all the time. And they were one of the pioneers to allow other doctors to know, wow, it's actually doable. All right.
So why did the doctor tell you don't eat fruit, rice, and potatoes and pasta to not that to lay off on that?
The reason why you want to lay off on that is because certain fruits have the highest content of sugar, really
Mm-hmm.
high content, especially like the grapes, the watermelon, the mangoes.
With oranges?
Oranges still not the sweet ones do, the sour ones not so much. But if
Mm-hmm.
you look at strawberries, raspberries, blackberries, they actually have the least amount of sugar. They're actually really low in the glycemic index.
Yeah.
Yeah. So, but rice is really high. That's why instead of white rice, I tell all of our diabetic neuropathy patients to eat wild rice
Wow.
instead. It's like the purple ones,
Oh,
dark
okay. Well,
purple ones. You want to eat those
will you
instead.
get that at anywhere?
A lot of stores have it. Yeah. Yeah. A lot
Wild
of
rice.
the wild rice. They're darker in color. They have more fiber. It takes longer to digest, right? And
Mm-hmm.
stay away from potatoes, the tomatoes, the bell peppers, because it causes a lot of inflammation. It's very
Yep.
toxic to the body. Those are nightshade vegetables.
So nitrates of potatoes and bell peppers is bad?
Yeah, potatoes, bell peppers, it causes a lot of inflammation. Tomatoes, eggplants.
Yeah, that's
So,
an eggplant, yeah. Okay.
yeah, yeah,
But
absolutely.
if you do eat it, would be in moderation, right?
Yeah, it's maybe at most one meal a week, at most.
Yeah.
So don't
Okay.
do more than that. Yeah.
Okay. Okay.
All right. Thanks, Crystal.
Thank you. Very inquisitive to learn about this.
Yeah. Anyone else have any questions before we hop off? 1 minute left.
Just want to thank you. It's very, very informative webinar. And
Abs
I'm looking forward to join more.
Absolutely. Well, we're going to do this once a month, and you guys will definitely get notifications on that. I'll
Mhm.
see you guys later. Have a great day.
Thank you. Happy New Year too.
Thank
Happy New
you.
Year,
Happy
guys.
New Year.